Hi, my name's Fiona Rogers, and I'm a physiotherapist from Australia. And it was my very great pleasure to be invited to write this clinical commentary on electrical stimulation for pelvic health for the POGP journal. My aim with this paper was to somewhat demystify the use of electrical stimulation. So it's one of those modalities that has come in and out of favour over the years, and depending on when and where you trained, you may or may not have had a good background in using it. So I find when I've been teaching this topic for many years, and I find there's often a lack of confidence for clinicians when faced with a stimulation machine and basically wanting protocols when if you can understand the principles of electrical stimulation, you can work out what will be the best protocol for your patient. So we start by looking at the differences and the similarities between TENS and NMES. And I'd look a little bit too at the nomenclature around it because that can be quite confusing as well. I then discuss the mechanisms of how each of them work and which you may be able to use on which pelvic health conditions. The research can be somewhat sketchy around this, mainly because a lot of the groups that were used in research were not homogenous. Methodology is not homogenous. So it's often comes down to, we're trying to compare apples with oranges. So we look at it deeply into that and try to help you work out where you should be clinically reasoning through which modality to use and for which condition that you should be using it for. Electrical stimulation is never a standalone treatment. It's always part of a holistic program for your patients. So for TENS, we cover not only pain, but also bladder, overactive bladder and bowel urgency by using it as tibial nerve stimulation or TTNS. And I'll talk a little bit there about nomenclature as well around the tibial nerve and posterior tibial nerve, which are in fact one and the same thing, which can become extraordinarily confusing when you're trying to read the research on that. Pelvic pain is another area that is basically there's a bit of an elephant in the room about that at the moment because there's some recent reviews have come out that on endometriosis, some excellent reviews looking at multimodal treatment for endo, but TENS doesn't feature in them. And the reasoning for this, we actually go into it, is that probably the actual evidence is hiding in plain sight. So have a good look at that for you, and also discussing it for dysmenorrhea, which we do have very good research on. So I hope you enjoy the paper, and I hope that it gives you confidence to try out electrical stimulation in the clinic. And if you have any questions, I'm more than happy to answer. So thank you for having me.